Hello, my name is Dr. Dewan S. Raja. Today I will solve multiple choice questions in the lower limb anatomy from question number 51 to 60. As usual, I will put the answer key as well as the link of my two books in the description of this video for your kind information. Let us solve the multiple choice questions. Question number 51. A medical student struck the ligamentum patella of a man with a reflex hammer to elicit patellar tendon reflex. Which of the following nerve is tested by eliciting the patellar tendon reflex? A. Femoral nerve, B. Obturator nerve, C. Tibial nerve, D. Common fibular nerve, E. Deep fibular nerve. So the student used the reflex hammer. He struck the ligamentum patelli. Ligamentum patelli is the continuation of the tendon of the quadriceps femoris. Okay, so that is the quadriceps femoris. Quadriceps femoris composed of vastus medialis, vastus intermedius, vastus lateralis, and rectus femoris. All of them are innervated by what nerve? The femoral nerve. So that is the quadriceps femoris tendon, then continued as the ligamentum patelli, and its nerve supply is from the femoral nerve. So femoral nerve is the nerve that is tested, and its root value, like lumbar 4, lumbar 2, 3 is tested. Number 2, 3, even 4 may come partly. Number 2, 3, 4 is tested by the reflex hammer by hitting on the ligamentum patelli. Okay. Question number 52. All of the following statement about the saphenous nerve is correct except one. The exception is what? It is a branch of obturator nerve. In the knee, it passes down between the sartorius and gracilis. In the leg, it accompanies the great saphenous vein on the medial aspect of the leg. It supplies the skin of the medial side of the leg and foot up to the ball of the great toe. Okay, it is a sensory nerve. So what is the exception? Which one is wrong statement? Answer should be this, A. It is a branch of the femoral nerve, not a branch of the obturator nerve. All other are correct. So answer is A. Okay, we got answer A. The first one, again, answer was A, femoral nerve for the patellar tendon reflex. This is the deep tendon reflex. Okay, so it is tested by hitting on the ligamentum patellae, and we look the functions of the femoral nerve, and we also look for the lumbar 2, 3, 4 segment of the spinal cord function. Okay, we got that. It is a branch of the femoral nerve. Saphenous nerve is a branch of the femoral nerve. Question number 53. A 25-year-old man stopped going to the gym to avoid COVID-19. He became overweight because he don't go to the gym, don't do physical activity, don't go out, don't take part in sports due to COVID-19. He likes to wear tight belts. That is his hobby and his fashion. He developed impaired sensation, pain, paresthesia. Okay, pain and paresthesia. Okay, he got that. He got pain and paresthesia. Okay. Okay, so he got pain and paresthesia along the anterolateral aspect of the thigh. The physician described it as Meralgia paresthetica. Meralgia paresthetica. Okay, which of the following nerves of the lumbar plexus is compressed in their scenario? Compressed where? Under the inguinal ligament. What is the answer? Ilioinguinal, iliohypogastric nerve, ilioinguinal nerve, genitofemoral nerve, lateral cutaneous nerve of the thigh, femoral nerve. Okay, usually it is obstructed under the inguinal ligament. It may be obstructed in the abdomen, behind the cecum, okay, behind the sigmoid column, okay, that is possible, but usually it is compressed, or it may pass through the inguinal ligament. What is that nerve from this? Iliohypogastric nerve, ilioinguinal nerve, genitofemoral nerve, lateral cutaneous nerve of the thigh, femoral nerve, okay, so anterolateral aspect of the thigh. Cutaneous sensation carried by what? Lateral cutaneous nerve of the thigh. Okay, there is a nerve for the lateral, the anterolateral aspect of the thigh. Okay, now we've gone through 53. Okay, so now we'll go 54. Okay, all of the following structures pass through the indicated hiatus except one. Exception is what? What is this hiatus? Adductor hiatus. Where it is located? Inside the tendon of the adductor magnus. What structure passes through it? Femoral artery become popliteal artery. Popliteal vein ascend through that, and it become the femoral vein. Posterior division of the obturator nerve that goes through the adductor hiatus and supplies the knee joint. Okay, Saphenous nerve does not go through the adductor hiatus. Okay, this is the muscle, the adductor magnus. It is a gap. This gap is the big gap, is the adductor hiatus, and it does not transmit the saphenous nerve. But these three is transmitted. Femoral artery goes to the popliteal fossa to become popliteal artery. The popliteal vein goes ascend through that, and it becomes the femoral vein. From the popliteal vein become the femoral vein. Okay. So now we'll match the cutaneous innervation of the foot. Okay, this is very important clinically, especially for the neurologist. It is very essential. Even for the general physician, we like to assess the spinal cord segment, because a lot of people has many diseases like diabetes. They have peripheral neuropathy, so we must have good idea about the cutaneous innervation of the foot. Let's start. Superficial fibular nerve. What is the superficial fibular nerve? Okay, that is the E. That is the superficial fibular nerve is here. E. Okay, try here. Okay, so here will be E. That is the superficial fibular nerve. Okay, then sural nerve is D. Okay, sural nerve is D. We got the sural nerve, root value S1, S2. Okay, S1 and S2. S1, S2. That's the root value. Okay. Then we have the superficial fibular nerve. Again, its root value is L4, L5, S1. Okay, L4, L5, S1. Okay, we got that. Deep fibular nerve. Here, deep fibular nerve is the B. B is the answer. This is the B. Okay. Deep fibular nerve root value L4, L5, okay, L4, L5, saphenous nerve, we'll go to the saphenous nerve, okay, here is the saphenous nerve, this is the area for the saphenous nerve, this area, okay, this is the area for the saphenous nerve, okay, got that, okay, so we got, this is the area for the saphenous nerve, and saphenous nerve, what is the root value? L4, L5, S1, okay, that is A, saphenous nerve, okay, so it is A here, saphenous nerve, that is root value is L4, L5, S1, okay, saphenous nerve, actually L3, L4, it is L3, L4, saphenous nerve, it is L3, L4, then medial plantar nerve, medial plantar nerve, what is the medial plantar nerve? C is the medial plantar nerve, okay, we can put it here, C, medial plantar nerve, its root value should be the L4, L4, okay. How about the lateral plantar nerve? That is L5, that is the lateral plantar nerve is F, okay. F, and the lateral plantar nerve root value is L5, okay. So we got the, again try, this is what, okay, let's try here, this is what, this is the saphenous nerve, this is what, this area, this is the superficial fibular nerve, this is the deep fibular nerve, this is what, 3.5 is the medial plantar nerve, okay, then 1.5 is the lateral plantar nerve, there is L5, this is L4, okay, this is the sural nerve root value S1, S2, okay, and that's all about the multiple choice question from 55 to 60. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel, please subscribe me, and the answer key again is on the description bar. Plus I have two books, I authored two books, that is anatomy test paper, and these are my book, two books, anatomy test paper and the lower limb anatomy tutor. So if you are interested, you may collect. It is also present in ebook format, so it will be easy for Kindle readers, can easily read. And that's all for today. Have a nice day. Bye now.